This is just to give you an idea of the type of teeth that we use. So as you can see from the layout here, there are actually three different types of teeth. So there are squarer teeth, there are more triangular teeth, and then there are oval teeth. And really the reason for showing you this is just to get an idea of the variety of teeth, and so the choice that you can get to really match in either to your existing natural teeth or to be able to get a look that was very close to the way your teeth would have been originally. And if I can just show you a close-up of some of these teeth. Just as I rotate these teeth up and down a little bit, it just gives you an idea of the realistic appearance of the teeth. These teeth are actually made in several layers, and so you can see as I go up onto the incisal tips of the teeth that you get a very natural appearance. At the Denture Clinic, we're always looking for better ways of making dentures and improving a patient's experience of wearing dentures. So I just wanted to show you a couple of quick examples. One of the big issues we have for patients who have some of their own teeth is a lot of dentures are made that cover over the palate, and clearly that will affect taste and enjoyment in eating. And so there are a couple of different ways of getting around this, and obviously it does depend on each individual situation. But just to give you an idea, here's one way in which you can have a metal framework that just has a small bar going across the palate, which just keeps the rest of the palate free, so that if you're wearing this, you really can taste your food and you can enjoy it. Or another example here is where you can actually have a horseshoe shape framework. Obviously this is just a metal framework, and the teeth will be put onto this. But again, the big advantage here is because of the shape, it's a horseshoe in shape, none of the palate is covered. And increasingly we're making more and more dentures like this if you have a few remaining natural teeth. And then just one final example here is for people who again have their own teeth. We find that for some patients they may already have had some crown work in their mouth. And so here's an example where on the back of this crown you've got what's called a special attachment. And what that allows is, this is the framework of the denture. If you place a framework over the attachments, they actually clip in very firmly into place. And again, there's almost no movement then in a denture that's made in this particular way. So that's really just to give you an idea of some of the things that we're working on here at the Denture Clinic.